Good morning, everyone. My name is Bipin Kumar. I'm a volunteer for the CSPC Events Committee. Uh, Thank you for joining us today. And today we are actually having an important conversation on today's panel, Dementia Prevention in Canada, Individual Risk and Collective Responsibility. Before we begin, I would like to acknowledge that while we are meeting virtually, we're all joining from various traditional territories across the Turtle Island. I am joining you today from Regina, which is the traditional territory of the Cree, Salta, Dakota, Nakota, Lakota, and on the homeland of Métis Nation. We recognize the enduring presence and the resilience of the Indigenous people across Canada and are grateful for the opportunity to gather and share knowledge on these lands. I invite our attendees to share their own land acknowledgements in the chat as we get started. Uh, we have an exciting update on real-time translation. We are now using Wordly to provide real-time translation and captioning for virtual panels. For live captions, click on the Wordly app button on the Zoom screen. For live audio translation in English or French, please click the link that we have just dropped in the chat. When open it in a new tab or on your phone and mute your main Zoom window. We would love your feedback on this accessibility tool. Now I would like to introduce our moderator for today's panel, Dr. Alison Secular, President and Chief Scientist of the Baycrest Academy for Research and Education and the Center for Aging and Brain Health Innovation, CABI. She is also the Sandra A. Rotman Chair in Cognitive Neuroscience at Rotman Research Institute. Dr. Allison, I will pass it on to you. Thank you.
Thank you so much, Bipin, for having us. And thanks to all of the CSPC and CABI crew for pulling together this amazing panel. While we are getting set to start the panel, I want to let you know that there's going to be a demographic poll launched. And you should please take a moment to answer the questions in the CSPC demographic poll. I'm doing that myself right now. Oh, we can't vote, but you should do it so we can get the information about who's here. We're going to be talking today around a really important issue, as Bipin said. This is the issue of aging and Canada. And it's really aging and the world, because the world's population is aging faster now than it has at any time in our history. And as the world is aging, as Canada is aging, that brings an increased prevalence of age-related diseases, neurodegeneration, et cetera, across the entire world. As a result, what we're seeing right now is that somewhere in the world, if I snap my fingers once every 3 seconds or so, every time I'm snapping my fingers, once every roughly 3.2 seconds, someone somewhere in the world is being diagnosed with dementia. And as the world gets older, right, you can imagine what will be happening if we don't do something. And with that in mind, there is really increased attention being paid to the growing importance and opportunity for strategies in the prevention of dementia, instead of focusing solely on treatment of people living with dementia or care for people living with dementia. And it is especially exciting for folks to realize that at least 45% of the global risk for dementia is related to things we've got some control over, some lifestyle modifications that we can make. And those modifiable risk factors can span your early life, your midlife, as well as your later life. They include things like lifelong education, avoiding social isolation and loneliness, managing chronic health diseases like hypertension and diabetes, making sure that you're getting your glasses up to date, you're checking your hearing, wearing hearing aids, and also avoiding toxins like minimizing exposure to drinking and smoking and air pollution. So this panel is going to discuss how we approach this new focus on prevention in modifying dementia risk throughout the life, and what a brain healthy Canadian society should and could look like. We're going to be taking questions through the Q&A feature that you'll see on the bottom of your Zoom screen. And we'll only be using the chat line to communicate issues with panelists or general comments. So if you have a question in particular that you'd like us to address, later on in the panel, please make sure it gets entered into the Q&A. And if you see a question that you like, instead of entering it again, just upvote the one that you like. And we'll be using that to rank order the urgency with which we can answer the different kinds of questions. And with that, I would like to now introduce our panelists. I'm going to say all of their names, and I'm going to ask them each to introduce themselves very quickly. So we have Dr. Samir Sinha, Dr. Saskia Sivananthan, Dr. Dallas Seitz, and Dr. Nicole Anderson. So Samir, can you quickly introduce yourself, please?
Sure. My name is, as you heard, Dr. Sinha. I'm a geriatrician and clinician scientist based at Sinai Health and the University Health Network. I'm also the Director of Health Policy Research at the National Institute on Aging, and I happen to be a CABI Age Tech Insights Fellow. And so happy to be here today.
Great, thanks. Saskia.
Hi everyone, Saskia Sivananthan. I'm co-founder and CEO of the Brainwell Institute, which is a think tank focused specifically on dementia and brain health and moving good quality evidence into practice. I'm also affiliate professor at McGill University in the Department of Family Medicine, as well as affiliated with CABI and as an Age Tech Fellow. So it's a pleasure to be here.
Great, thanks for being here. Dallas.
Hi, I'm Dallas Seitz. I'm a geriatric psychiatrist and chief of geriatric psychiatry at CAMH, and I'm a health services researcher.
Great, thanks. And last but not least, Nicole.
Hi, I'm a senior scientist and the director of the Ben and Hilda Katz Interprofessional Research Program in Geriatric and Dementia Care, as well as associate scientific director of the Kimmel Family Center for Brain Health and Wellness, and professor of psychiatry and psychology at the University of Toronto.
Great, thanks. So I'd like to just start the discussion by touching on our awareness and understanding of dementia prevention. We've also asked you in the audience now to share your own understanding of dementia prevention in the poll that's just popped up. So please take a moment to share your thoughts in the response to those questions. And just as a little bit of background, CABI recently did a survey of more than 2,000 adults, and this is in our Age Tech Insights report. And what we found there were really stark gaps between the awareness of dementia prevention and knowledge of how to act on that awareness. And specifically, about 2/3 of adults actually knew that dementia risk could be reduced, but nearly 3/4 of the people believed that their actions in midlife had an impact on dementia risk. But less than half of those folks felt informed about how to reduce their risk, and only 17% felt more than a moderate confidence in being able to do so. So we've got the vast majority of people knowing there is something that can be done, but the minority knowing what to do about it. So as we start, I'd really like to ground the conversation in a simple but important question. While awareness with dementia risk is growing, many people still don't know what to actually do about it with that information. So from your perspective, where is the biggest breakdown today? What are the obstacles that individuals face in making choices that support their brain health as they age? Samir, let's start with you. And chime in if people want to chime in as well, but we'll just start with Samir.
Yeah, no, so Alison, this is kind of, there were good things from this survey work that, happened to say that more and more Canadians are aware, and people in the UK equally are aware of what they can do to promote, kind of brain health and healthy aging. So that's the good news. As you noted, it's just kind of this knowledge to action gap. And I think sometimes, you say we should exercise more, maybe we should, drink in moderation. Just things like this. But again, I think sometimes the breakdown is, so what does that mean? For example, like how much more do I exercise? And knowing the answer being 150 minutes a week, maybe break it down to 30 minutes a day for 5 days a week. You can still have 2 days off. And then people say, what's the level of intensity? So I think some of those questions that start coming into, I know that I should get more sleep. I know I should exercise. I know I should eat in moderation. But what do we mean by those things? And then how do people practically put those into action? I think that's the opportunity now that people know kind of that these things are good is really, I think our job is to be better at communicating exactly how you can do those things in a variety of ways so that people could say, yeah, that works for me. I'll do that. And I know that if I do, there'll be some significant dividends.
Yeah. Nicole, what are your thoughts on that?
Yeah, I think it can be overwhelming for people because in that report that stated that 45% of dementia cases could be prevented by 14 modifiable lifestyle factors. Well, 14 is a lot to change in your
Yes.
lifestyle,
Yes.
right? So, and it's also telling us at the over all people. But I think what's also missing is the personalization of having a way to assess where are your biggest risks, what should you focus on? And if people had that, they might feel more empowered and less intimidated by the overall message.
Yeah. Dallas or Saskia, is there a way that you find it's easier to sort of digest this information? Because also, I should say, the 14 risk factors that are identified in the Lancet report are the 14 that have met very, very strict clinical standards of getting in there. I fully expect that sleep, for example, will end up there in the next one, as well as a couple of other factors. So, how do we help people digest this information? Dallas.
So I agree. I think one thing that's, can be helpful is, as Nicole was saying, like getting to know the individual and sort of like which of those 14 risk factors may be most salient. And then there's also, which ones might be people maybe are most motivated to change, where there's like some other salience or relevance to it, because a lot of these things do involve all of them. If you think about exercise and smoking and alcohol,
Right.
all of them involve behavior change and specific behavior change, to address those things. So I think, yeah, making it personal, to the person, trying to, focus on one area, at a time, and also looking at what's feasible, because some of the behavior changes, while it might be nice to say, well, you should get your hearing corrected. Well, if you don't have money or if policy doesn't support hearing aids,
Right.
that's not something we don't advocate for, but some things are going to be more feasible for others to address, in the short term or a bit more under their control than other things where, if they don't have transportation or access to specific programs, it can actually be a bit demoralizing to suggest changing things that you really don't have much control over, which outside of your behavior, often we don't have a lot of control.
Yeah, and Saskia, just on that point, I mean, from your perspective, what are the obstacles, and if it's not just awareness as is being suggested, what else is preventing people from turning that knowledge into action in their daily lives?
Yeah, we've been doing community events where we really try to have small group educational events and try to make it as sort of open and accessible as possible for folks to ask questions. And one of the things that strikes me over and over, no matter how many times we've done this across the country, is the Q&A sessions are
Yeah,
usually an hour, if not more,
yeah,
because people are really eager and have a lot of questions. And I think I totally agree with a lot of what all the other panelists said. And yes, there's the behavior change, which can be difficult because the kinds of factors we're talking about are not just quick, easy fixes. But I think the other thing that we also are hearing is that people are overwhelmed not just by the number of factors, but just by the onslaught of information around risk reduction.
yes, yeah,
So they kind of get conflicting messages and are not necessarily sure how to sift through and what might be most valuable or not. Like we had a session just in BC on Saturday. And so some of the questions we got were like, is a glass of wine harmful? Or now is it protective? Which one is it? How do statins affect my dementia risk? Should I even be not taking my statins medication altogether? Like, and so those sorts of questions. And then, of course, we're talking about all the others around exercise, sleep. One of the other ways that the other piece that I think is sometimes missing in the conversation is sometimes drawing the connection between brain health and heart health and
yes,
just holistic health, that this is not, our brain is not off on its own. It's part of a broader body, and it's linked to your heart health and everything else. And
yeah,
so sometimes helping people see it that way is helpful. But I think to Dallas's point, we put a lot on the individual, and we do need to look at the systems that would support them. But I think those are some of the pieces where practically the practicality of what those recommendations are, and then how they can filter through which information is actually accurate versus not, has been
yeah,
the other
yeah,
barrier.
yeah. And the heart health, brain health link is really, really important for people. And we have an acronym that we use to help people just remember what to do to live a brain healthy life, which is just be bright, where B means move your body, R is rest and resilience, I is interacting socially and cognitively, and G is glasses and hearing aids, H is heart health, and T is toxins, so avoiding alcohol, air pollution, and smoking. So if you just can think about be bright, that's good. But that H, that heart health, is if you think about the 14 risk factors that have been linked in the Lancet report, the vast majority of them are also linked to various kinds of heart disease. So Nicole, I know in the Kimmel Family Center for Brain Health and Wellness, which you co-direct, you're taking a specific approach to that personalization and helping people get started. I wonder if you can just say a little bit more about that.
Yeah, sure. The Kimmel Family Center for Brain Health and Wellness is a big research study. So it's a community center delivering a big research study where people get a comprehensive dementia risk assessment, looking at both non-modifiable risk factors, so age, sex, genetics, but also a whole host of different modifiable dementia risk factors, including the ones that we've talked about here, as well as our diet and mental well-being. And then based off of the assessment, people get a personalized program strategy telling them which domains of activities they should focus on to help reduce their risk. So if somebody's already exercising enough, they don't need to hear about exercise. They're already doing it. So again, getting back to the idea of minimizing what people have to focus on. And then, but also within that, we don't tell them how to address that risk domain, because people do have different motivations, as Dallas was saying. They have different things that excite them and engage them. They hate certain other activities and are never going to take them up. But we just give them a whole menu of opportunities to engage in. What you would see in any typical community center or YMCA, those kinds of programs.
You have like
But just helping
350
people.
different individual programs right now. Is that right?
Yes. Yeah. This semester we do. Yeah.
Sorry, go on.
Can I just
I
jump
interrupted
into
you.
that, Allison?
Yeah. Go ahead, Saskia.
Please
Yeah.
go ahead. I was going to say that in a lot of our community sessions, this question comes up, like what could we, where can we go, guide us practically? And I often refer
Yes.
people to Nicole's website and to the program. And they love the idea that it could be offered through community centers because that's very
Yes.
accessible to folks.
Yeah.
It's non-threatening, but it's still very individualized. And so it's a fantastic approach.
Yeah. Dallas and Samir, what do you think of the approach of offering these kinds of activities, partnering with community centers as opposed to a medical model where, someone has to come into a hospital or a doctor's office to get the advice?
Yeah. I think that's often, I think as a clinician, this is part of what we struggle with is actually we identify these risk factors or changes that would be helpful for our patients, but the solutions are not in the health system. They are
Right.
in the community. And I think, like Nicole was saying, one of the challenges is that finding that information is very like context, community dependent, and there aren't one-stop shops. Unlike, it's sometimes much easier to Google a diabetes wellness program, or if you've had heart disease, there are kind of like wraparound programs that bring that all together. It's often these, a social program and an exercise program and treatment for, depression or what have you, are kind of like scattered, within the health system and then outside of the health system. So I think that sort of those hubs or bringing that information together in a way that kind of can lay it out for people really makes a big difference, but can be challenging to kind of track that down. And we don't have brain health programs that you could refer someone in when that that's already kind of baked into the program.
Yeah. And Samir, I know you've given a lot of thought to some of the issues that just came up, which is these gaps in reaching people in different communities, whether it's people from different racial or ethnic backgrounds, different socioeconomic status levels, the 2S LGBTQIA plus community. Like, how do we make sure that we're reaching everyone that we need to? Because often, the risk is going to be higher in some of these communities than it is in the people, white Western European, upper middle class folks who live right near the hospitals. How do we make sure we're reaching all the right people and bridging those gaps?
Yeah, so as you're saying, a lot of these solutions and a lot of these opportunities kind of should be embedded in, existing community structures that people are engaging with. So if you look at local, gathering centers, places where people can participate in these activities, this is great. This is where it should live because this is where people are generally already hanging out. It's how do you make that connection, if you will, between kind of the medical and the broader system. And so sometimes, I think the opportunities for folks like Dallas and I are to say, that people are talking increasingly of social prescribing, for example,
Right.
that you might say, look, your brain health, your heart health, there are things that you can do, and with what's being developed, for example, the program at Baycrest, an online kind of, I think the future idea here, as I understand it, is that, one might be given, kind of a prescription, you might go to this website or so on. You can kind of, then figure out, what are the things that you might be able to do to almost get your own individualized prescription where you might be able to carry it out, for example. And that way, be enabled, so that you're not, so that you can have a bit of a personalized plan, and something that does make sense and allows you to actually carry it out. So I think this is where there's that broader need for a system that really encourages and enables people, if you will, to better kind of carry out the things that really can help, keep their brains healthy, keep their hearts healthy, and also prevent dementia as well.
Yeah. Other thoughts from folks on how do we make sure that we're reaching everyone, meeting people where they are really, and meeting each person's individual needs? And Nicole? Nicole?
I would just say, I think one area that we as researchers have to do much better at too is looking at what are the specific constellation of risk factors that are relevant for different groups as well. So Canada came out with their Lancet version, and found that 49% of dementia risk in Canada can be reduced through 12 modifiable factors. Well, that's Canada writ large, but that might not hold in, say, Indigenous populations or large Asian populations in Vancouver, say, or whatever. So I think we need to narrow down on what are the specific risk factors that are important in different groups that really make a meaningful difference, so that we can also better tailor our messaging to people as well.
Yeah, we do a lot of work in Baycrest and Cabby with our partners up in the Yukon. And one thing that's interesting is when you look at the statistics in the Yukon, it's actually like a bimodal distribution of where the risk factors are, because there are the folks who are indigenous to the Yukon, and then there's the settlers, and each of those groups has different sets of risk factors. So you couldn't say, here's how you address it, even just in the Yukon. It needs to be much, much more specific. Saskia, I think you wanted to chime in as well.
Yes, I think I wanted to touch on Samir and Dallas's points about we put a lot of this emphasis on individual prevention, and there is absolutely that case to be made around behavior change, et cetera. But one of the things that we've started looking at is better understanding how other conditions really make those kinds of changes and systemic changes to enable better prevention, screening, and what we saw with conditions like diabetes, cancer, stroke, is recognizing that the environment has a very big role to play in this, and then again, that system coordination is what enables that access.
Yeah.
And just to Dallas's point, if you're looking at brain health, there is no brain health program per se. There's no one place to refer to or to access the suite of information and to have it in a tailored approach. And something that diabetes, for example, has done very well is create the kind of coordination so that you have a diabetes educator who, at the point of diagnosis or pre, will be able to help guide the person through what that educational system needs to be, what the behavioral change needs to be. There's a whole program holistically designed around the person. So that system coordination becomes really important. But the other piece I wanted to also touch on was just again, recognizing how important the environment is and where that
Yeah.
environment is that people live, like you just pointed out in the Yukon, right? Such an important, and that's specific to communities. But then if we're thinking, you know, even smaller than that, sometimes it's about access, right? If you're talking a rural community, presumably, access to a hearing specialist might be very difficult, or access
Yes.
to and to
Yeah.
the kinds of exercise programs that would really enable that kind of change. Or there's cost and accessibility, because hearing aids are expensive, right? Sometimes the decisions around healthy foods are expensive. So those social determinants become so crucial. And we know that in more diverse communities, that's one of the biggest, that's one of the key factors that often is harder to see and then to support. And we also, stigma around
Yes.
how
Yeah.
that kind of change and what that looks like. Hearing is still quite stigmatized, right? Hearing loss. And so even when we say that might be one of the easier factors to fix, um, how is that approached in different communities, and what does that look like, becomes some of the pieces to consider.
Yeah, you're bringing us beautifully into sort of the next topic of discussion, which is exactly what you've highlighted, these system level barriers for implementation. So the modifiable risk factors for dementia are linked to behavioral changes that individuals can make in their lives, like getting more exercise or being treated for high blood pressure, using hearing aids. For people who are listening and don't know this, the hearing alone accounts for 7% of the global risk for dementia. So it's a very, very big percentage of this, and we can talk a little bit more later if people would like on why that might be. And vision, when you add vision and hearing together, are about 9% of the total global risk. But so those are things people can do on their own. But then there are also these behaviors, as you're mentioning, that can be supported really better by system level changes made at the level of health systems, communities, or broader society. So, for example, could the provincial healthcare system offer subsidies for community exercise programs or medical devices like hearing aids or others? And what could we do as a society to reduce air pollution issues? Because again, that's, yes, I can wear a mask if I'm in a polluted area, or I can make sure I check the air quality index, but I can't solve air pollution on my own. So, question for all of you: what do you consider to be the largest system level barriers for dementia prevention, and how should we think about this balance between asking people to make behavioral changes themselves and giving them that system level support? Who wants to start with this?
I can
Samir. Yeah.
I can have a go. I think again, when we think about, as you said, some of these maybe more non-clinical things like not smoking, for example, or drinking in moderation, where maybe your healthcare provider can give you that guidance of what you need to know. I think some of these risk factors, beyond hearing aids, et cetera, get into these issues about being socially engaged. Preventing loneliness and social isolation, but also as we talked about, exercise and how do you obtain that. And so I think when we start thinking about where does this occur, this stuff occurs in the community, not necessarily in specific hospital or healthcare driven programs. And so if we're not creating kind of the societal infrastructure to facilitate that, then we're not going to be able to help address some of the more significant risk factors. So, one example that we did years ago in Ontario was we provided funding through the Ministry of Health to create 2,000 free exercise and falls prevention classes. And we deliberately said the funding is going to community, organizations and spaces where older people can actually gather. So these have to be publicly accessible places. And there was a two-pronged approach here. One was, we were making it barrier free. So it was free. It was available maybe in a language or in a community space that you felt comfortable in. You were doing exercises that with a goal in mind of helping to prevent falls, but these exercises can help a bunch of other things.
Yeah.
And then finally, it's also an opportunity to create some social engagement and potentially an opportunity where people can build stronger connections in their communities, maybe build and stave off loneliness and social isolation. So while not a specific, kind of a dementia prevention initiative, you could see how building some of that infrastructure and that scaffolding can then better empower communities and the people they serve to be part of these solutions as well. And so you can see how you could take that and maybe layer on an aspect of, is that exercise program not only preventing falls, but also supporting, a healthier brain as well. So I think this is just some of the things that I see as ways that we could address some of those things that are, if you will, less concrete and maybe less easily delivered by, say, a healthcare provider.
Yeah, just a question for all of you, just following on what Samir said. Do you think we might have more success in moving some of this along if instead of saying, okay, we need a program that focuses on dementia prevention, we do sort of think about how is it rolled into healthy aging more generally, including heart health and so on? I mean, is there a little bit of the different diseases, if you will, competing against each other for attention? What are your thoughts on that, Dallas?
Well, I'd just say like brain health is really, it's like the intersection of like physical health, including vascular, but not just and mental health, right? So it's not a separate thing. It's really, that combination of, of both, physical and mental health. And I would also like from a systems perspective, I think there's a very important role and, perhaps in terms of policy and advocacy for primary care because a lot of some of the interventions are going to be in the community, but often management of heart disease, prevention of heart disease, diabetes, mental health concerns, that starts with solid primary care, preventative medicine, minimizing complications of these chronic conditions. And without solid access to primary care, it's really hard to make headway on prevention or management of a lot of these conditions. I think primary care also does a great job of looking at the person's health kind of holistically, including like those social determinants of health. So I do think from a systems perspective, it's going to be hard to move the needle on some of these things without ensuring that our primary care system is working as best it can, and that that brain health is sort of baked into primary care, but ensuring that people do have adequate access to primary care is going to be an important systems consideration as well.
Yeah, Saskia, I mean, just on that topic, I mean, how should these conversations about dementia prevention account for inequalities to access that are linked very often to inequalities in socioeconomic status or other structural barriers like transportation, rural settings, cultural differences? How do we level the playing field there?
I think for me, it comes back to that earlier question you had as well about our balance in terms of how much it's an individual responsibility versus a system enabler. And, Dallas is right that you need access through primary care. That's the entryway, and that would be the entryway for all folks, regardless. But from my perspective, I think while we don't want conditions to be competing, there's lots of lessons to be learned from conditions that have been able to really move forward the kinds of pathways that enable broader screening and prevention upstream so that you're not getting to that acute only approach. And I think with dementia, because we've not had enough of that upstream intervention and coordination, we're seeing a lot of people who are ending up in crisis who are at the acute end. And really struggling. And we're seeing that in the comments in the chats as well, right? Where folks are just not feeling they're getting access to the kinds of information they need or want when it comes to dementia. So I think that a more systems coordinated approach, and we've been working at the provincial levels to do that through our task forces, is recognizing that you need, first of all, people living with dementia and their care partners front and center to these conversations. They are sharing their experiences, and that's what really shapes how our system needs to move forward. But that kind of accountability sits at the provincial level. Understanding dementia accountability and coordination sits at the provincial level, and then integrating it into brain health approaches, healthy aging approaches, cardiovascular approaches, because it is holistic. so that you're not having it siloed, but really having a more
Right.
integrated, coordinated approach. And that I think is what will start enabling better equity discussions, because we don't even know the gaps right now because we don't have the data that we're collecting to understand what
Yeah.
that looks like or what the program gaps are. So I say this sometimes facetiously, but I feel like you're flying without air traffic controllers when it comes to dementia, and so we're asking people to figure out where to go and how to go. They're the air traffic controllers, but that should really be at the systems level, so that then once we've created the coordination structures and accountability, we start really looking at how do you expand the screening, how do you expand prevention, what does that education mechanism look like, and then how do you integrate into public health, community-based
Right.
settings,
Right.
and primary care for all of that.
Right. I wonder, Saskia, can you just very quickly let people know this new task force that's being launched? Just very quickly, can you summarize what that is and where does dementia prevention fit in?
Yeah. So these task forces are bringing together organizations within provinces that provide any form of care or services to people living with dementia, and includes people living with dementia and care partners. So we're talking across all the sectors. So really recognizing, what all of the panelists have said: primary care, acute care, long-term care, home and community care, rehabilitative care. That's another component that often gets overlooked: re-enablement for people living with dementia. So not that you can necessarily reverse, but that you can maintain for longer, hopefully, the kinds of skills that they might want. But bringing all of those sectors together, as well as the public health and community based approaches, because so many of these sectors and organizations are delivering programs and
Yes.
services.
Yeah.
Samir just talked about some of the ones that he's been involved in. Nicole's creating ones, research. But because we don't have the
Yeah.
coordination and integration, we don't know where our gaps are, and therefore how we can really better sustain and support the pathways. So the task force is going to be designing a roadmap to what that coordination can look like for dementia, and prevention and risk reduction is going to be a crucial aspect upstream, in addition to the overall pathway. And how do we support government to be able to create that accountability at the provincial level?
So it sounds like there are a couple of different priorities then for Canadian policymakers. One is getting the information about what are the barriers, and the other is figuring out, creating a pathway for coordination. For each of you, what do you think is the biggest priority right now for Canadian policymakers? What needs to be done right now to support dementia prevention? So, Saskia, if you want to add something later, you can, but you've already sort of spoken to it. So maybe Nicole, Dallas, Samir, what do you think are the biggest priorities right now? Nicole.
Yeah, I mean, I think I have to upvote Dallas's comment that because it all starts at primary care, really reinforcing getting that back to where it used to be so that everybody has access. Um, I think that's one part coming from the medical perspective, but I think at the same time, we can create systems in the communities that help people to become more proactive on their own too, right? So we can approach it from both directions. Of course, somebody can't fix their own hypertension. I'm not talking about that, but some of the other risk factors, if we can embolden the community centers, the libraries, the colleges that are offering adult learning classes, things like that, and then also come at it from primary care, then we can get a long way.
Yeah, can I just following up on that, because a question did come in that's sort of related to it, which is the role of municipalities. So we've talked about there's what federal responsibilities and provincial, but what's the role of the municipalities in supporting all of this? It sounds like, Nicole, a lot of the things you're talking about are actually at that municipal level.
Right. Well, there's the notion of age-friendly communities, and it would fit within that. I mean, that has a lot to do with safety issues as well, but it could be more than that, and it is often more than that, of offering older adults opportunities, be they educational, so cognitive, social, for exercise, etc. So, and that is, you're right. So um, the the municipal recreational programs, making sure that there's
Right.
sufficient numbers of those for older adults and that they're free or very affordable, things like that.
Yeah. Dallas, Samir, anything you want to add in terms of biggest priorities for Canadian policy? Dallas, yeah?
Well, I think also, like as you mentioned with your survey too, there is still a ways to go with public awareness, coupled with some practical strategies or resources around some of these. So I do think there's perhaps some need for like a brain health strategy and maybe some key metrics around awareness or things like that, to sort of raise more awareness of this in the public, including I think also a lot of this conversation does get framed in older adults who might be, you know, experiencing cognitive problems. And I think we need to like maybe think about that messaging, getting down a little bit earlier, because I think a lot of it right now is like we're picking it up kind of when the horse has left the barn, so to speak. We're changing a lot of these risk factors and things, often it may not come up until there's some other age-related issues that are sort of in the mix. So, trying to shift that messaging perhaps a bit lower and raising awareness earlier on.
Yeah.
Yeah, and just building on kind of what's been said as well. I think again, as Dallas was saying, how do we go to younger populations, and how do we actually promote better awareness, kind of
Yeah.
as a society? Because I mean, there's some kind of neat stats saying that if we could prevent or delay the onset of dementia by 10 years in Canada, for example, we could be saving $77 billion, for
Yes.
example, in terms of
Yeah.
reduced overall kind of health system and broader costs that way. So there is a dividend that we could all benefit from in society. But then it comes down to making sure, are we making sure that everyone's wearing a helmet, to prevent traumatic brain injuries, for example, if you're using a scooter, or if you're on a bike, for example, or playing certain sports, for example. What are those sorts of intentional things we know there's really good evidence to promote better brain health later on. But then it's not just kind of saying, for example, we need to, our municipalities need to step up more. Part of this is also, how do we actually appropriately invest, as part of a federal strategy or provincial strategy, to say these are those investments in terms of having those accessible exercise, classes
Yeah.
or
Yeah.
opportunities, so that people can actually go and engage in a way that intentionally helps support them with their brain health. So these are the elements that we need to, but I'm glad that we're thinking about more coordinated pathways to help people to engage in more brain health, kind of, or healthy brain activities, if you will, but also kind of improving kind of awareness of other things they can do to get an earlier diagnosis and management and support if they do have something like dementia as well.
Yeah, it's interesting you talk about what governments can do to sort of support some of these initiatives, especially for folks who don't have access. I'm thinking about in the state of New York now, there's a company called LEQ, which is a social engagement robot, a tabletop robot that Cabby and Baycrest supported the development of this a number of years ago. You might have read about it recently in the New York Times. New York is now like getting a whole bunch of these and giving them out to folks in rural areas of New York, older adults who are at risk for social isolation. So yes, obviously, being around people is the best, but if you're in a place where you can't get out of your house, this is LEQ. Anyone who comes by Baycrest can chat with LEQ in our Cabby space. I've lived with LEQ for a while when I'm traveling, and I always feel like really guilty when I have to put her back in the box. I feel like I'm murdering this robot. But that's really just to say that there's these technologies coming online too now, right? So I mean, yes, you mentioned things like bike helmets, but technologies advancing so rapidly right now, and as we've seen this rise in dementia prevention over the past 10 to 15 years, we've also seen an increase in the development and adoption of consumer digital technologies, not just these sorts of robots, but even things like smartphones and watches, so that we can now be tracking how we're doing on all of these different kinds of activities, whether it's exercise or sleep and so on. And Cabby did another Age Tech Insight report where we surveyed older adults, and that actually showed, contrary to what many people might think, that about 95% of adults 50 plus are using smartphones and similar devices in their everyday lives. And so those sorts of devices can be used to give you feedback for your healthy habits. But smartphone use, especially for things like social media, which a lot of people are also using, can also be associated with mental health concerns, right? So, and then there's also the recent rise in use of and proliferation really of artificial intelligence tools like chatbots. People are increasingly using those to seek medical advice. And the recent national AI strategy is specifically highlighting health sciences as one of the 5 priority sectors for strategic investment to support new AI powered tools. So my question for all of you, keeping all of that in mind, is really how do we see these new technologies, whether it's trackers or AI or social media, how do we see them intersecting with the promotion of brain healthy lifestyles? And should we be harnessing the technology or be wary of relying on it too much? Samir, maybe we can start with you on this one.
Yeah. So when I think about, kind of the opportunities with technology, I think we have to just really be mindful and cognizant of what we're trying to accomplish and making sure that we do it in ethical and enabling ways. Because, I'll be devil's advocate. Someone, is lonely and isolated, and so we give them kind of, as you said, an LEQ, for example, to help engage them. But then might that also, get them so addicted to having this companionship with this robot that they're actually not being encouraged by, to actually be able to develop, human connections, that can help you, go for a walk or be your walking companion. And thinking about kind of how we design these things in a way that will accomplish kind of the most good. So I have this kind of idea in future about technology devices, that might actually be kind of your own, almost your kind of your brain health assistant, in terms of saying, great that we've done some chats, but maybe we can chat and go for a walk, or, maybe going for that walk, hey, you need to get your 30 minutes today, or let's get our steps up, or, or do you want to learn about something new, today we can engage you on that way. So I always just think about kind of, are there, I think a lot of the tech that's out there right now is focusing on a very specific objective or issue, for example. But I always wonder about ones that could be, almost you have a module in there or kind of a mechanism in there that might actually also, help take these 14, recommendations that the Lancet has, and encourage us to incorporate as much as possible into kind of our daily activities. I think that would be the next kind of generation kind of health app that really kind of encourages us to get that brain health dividend, if you will.
Yeah, for sure. And LEQ, just to be clear, does some of that already. And one of the things that they've done also is they've incorporated all of the Defy Dementia podcasts in there. People who don't know, we have a podcast called Defy Dementia that really focuses on dementia prevention. And LEQ will dance with you, and actually will encourage you to go out and meet with people too. So she's not just keeping you to herself. Nicole, you wanted to chime in here?
Yeah, I think quite similarly, but my future vision of the Kimmel Center is that it becomes an app in a way, that people get their assessment for the modifiable factors, lifestyle factors, through an app, answering questions, and then get their personalized program strategy on the app. And there's trackers to see how they're doing with that. But then even beyond that, it gives advice about, where could you find cognitive engagement in your community? So somehow I have to harness all the data of like where everything is and do what we were talking about previously, of figuring out where are the resources that we could connect people to. Where could they exercise, and reminding people that even if they're in a rural area, walking is an aerobic activity if you're walking briskly enough. So you don't have to have a gym around the corner. So I do see what we're doing hands-on in person in the Kimmel Center gradually becoming virtualized, not necessarily with
Yes,
virtual
yeah.
programming, but that could be part of it as well. It could be like a Zoom exercise class, but telling people where they can go in their community to find advice about healthy eating or about physical activity or mental well-being courses, meditation programs, things like that.
Yeah. Saskia, you want to chime in?
Just very briefly to touch on, I've also been thinking, about the AI strategy and then generally around AI. And I mean, I think most of us have heard about how sometimes ethically it might not be going in the direction that we think it is, but there's also ways to be able to provide the kinds of, data that would enable that more practical
Yes, yeah.
approach. And for me, the opportunity also comes to the screening aspects and the earlier steps, because if people are
Yes.
worried, and this happens all the time, like I've seen it with family members where they'll get a report on, I don't know, an x-ray that they've just taken, or a CT or an MRI that they've just done. And Samir and Dallas, you probably get patients who come in and say, oh well, I put this into ChatGPT and this is what it told me. But there's also that opportunity then to build on that, to be able to also show how that might link to more preventative, holistic lifestyle approaches that the person can take, and where AI could give them, that more tailored approach, building on what Nicole said. So there is opportunity, I think. And people, I think part of the reason why people are relying on AI for health advice is because it can feel tailored and it can seem tailored to the question that they are asking versus the broader approach. And so that could be an opportunity to harness along with all of the technology that you've just mentioned, Allison.
Yeah. And I think that, when thinking about the technology and where it could be taking us, I wonder if this is also a way to get more attention about the importance of these issues from the federal government and the provincial governments. Because right now, I mean, we've sort of touched on this. There's, oftentimes the federal government will say, well, health, that's a provincial issue or a territorial issue. But the economy, well, now that is a federal issue, right? And so is there an opportunity for us to reframe the conversation a little bit and to highlight that dementia is not just a health issue, it is also an economy issue. And there's this concept of the brain economy, which is really what can we do to maximize people's brain health and their brain skills. And by doing that, we can increase Canada's economic prosperity, we can increase Canada's sovereignty, we can make Canada a more just and like just more Canadian place to live. It's almost Canada Day, so I have my Canada mug, and I'm really thinking about like what can we do to sort of set Canada apart. The whole concept, actually, of the brain economy was started by a Canadian years ago, but we haven't really seen that much takeoff. And what I mean by that is, for example, Samir mentioned some of these statistics around how much money we can save if we could do earlier diagnosis, right? Or just some early prevention. In terms of the people not just diagnosed with dementia, but people who are caring for folks with dementia. We always say every time one person is diagnosed, the whole family is diagnosed as a caregiver, right? And there's unpaid costs of caregiving that people are spending. And it's expected that right now we have about 40 million unpaid hours of care every single year. By 2050, it's expected that the amount of if you were to turn that into wage, equivalent wage, $1.4 billion would be the wages that people would be sort of foregoing in unpaid care. And as of last year, the Canadian government, the cost to the economy, I should say, for dementia, both indirect and direct, was already $40 billion, which is a very big chunk of our GDP. So if we can reframe things in that kind of framework, right, so that dementia prevention, yes, of course, it's helping people live healthier, but it's also helping people contribute to the economy more. It's helping them live more fulfilling lives. It's helping them contribute to society more. Does that bias anything in terms of getting the attention of policymakers? I see people nodding, so who wants to chime in here? Nicole was nodding. Oh, no, Samir went off mute. So Samir.
I'll go for it. No, I mean, I think it's important to really frame all this as an economic productivity issue, as you just said, right? How do we actually get policymakers right now who are appropriately obsessed about trade and our economy, also appreciating how, kind of brain health, is something that can support economic productivity. We're looking at significant labor shortages that we have now and into the future, and if people cannot continue to remain in the workforce because of unpaid caregiving duties that they can't balance with paid employment, or people develop cognitive impairments that preclude them from participating actively in the economy. This is kind of, this is where I think we identify this as an economic, an imperative that really kind of helps, us to maintain a healthy society and a productive society at the same time. So I think there is something to be said about helping to reframe this appropriately so that we can get people more engaged on this and not just thinking that this is some abstract concept that has nothing to do with kind of our overall economy as well.
I also think we need to highlight that there's a snowballing effect there too, because being a caregiver increases your risk of dementia by up to 6%, 6 times.
6 times.
And so the family becomes a caregiver, then their increased risk of developing dementia, then their families becoming caregivers, and so on and so on and so on. So it has an exponential effect on the economy, really.
Yeah. And I haven't. Oh, Saskia, go on.
No, go ahead, Nelson.
I was going to say I haven't had to deal with being a direct caregiver in dementia, but I have been a caregiver for other things, and even for short periods of time, even if you haven't come out of the workforce, you can't get all your work done, right? And you're spending you're not sleeping well, you're not doing all the other things. So just to be clear, when Nicole says being a caregiver for someone with dementia increases your risk by up to 6 times, it's not because dementia is contagious. It's because if you're taking care of someone else, it's harder to take care of yourself and all of the increased stress and so on. Saskia?
I just wanted to chime in to add. So both of those reports and the statistics you were mentioning came from the Landmark study series, some of it anyway, that Josh Armstrong led through our team when we were at the Alzheimer's Society of Canada. But the third part of that report that hopefully will get taken up was the economic impact. So it was looking at if you could delay dementia by even 1 year, how much does it save us? What does that look like from a brain health perspective?
Yeah.
The second report was looking at the diversity of people who'll be living with dementia, because, we touched on that briefly. 1 in 4 Canadians will be of Asian descent. And we know that with dementia in particular, that cultural component, linguistic component becomes so important to the kinds of care. But that also looked at caregivers in that second report. And, exactly as you said, caregivers of people with dementia in particular are different from caregivers more broadly, because the increased caregiving needs, you go from maybe 26 hours to almost 40 hours if you're providing round the clock kind of care for caregiving. That has huge economic impact. But there's also been a movement sort of under sort of the brain economy idea. And Harris Ayer, I think, has been leading some of that work, which has been thinking about brain health and earlier brain health. So in younger people, thinking about around resilience, around stimulation, around agility, because we're going to have to respond now to these huge, influxes of information, technology. How are we adapting and responding to that? How our brain is able to adapt to that is going to be much more different than what we've even been experiencing. We're at that huge inflection point with AI and its capacity. And that actually is trillions of dollars potentially in economic impact. So I agree with Samir that yes, policymakers absolutely are obsessed with the economy and what that means for Canada, but that thinking about brain health as a health issue is detrimental. In fact, this is a much broader issue and not just a health issue. And sometimes we have to reframe that to meet the economic need much more than just the health need.
Yeah, and I think in talking with Harris and others, because there's a big Canadian content in the global brain economy discussion that's happening right now. Canada is actually really well positioned in a lot of ways to be able to take the lead in this discussion and moving it forward, because we're big enough and diverse enough that we can see, will it work for a non-homogeneous population, but we're small enough that we can be sort of a test bed. So we're almost like a microcosm for the world. So one of the ideas that we've had in discussing it with the bigger global group in the brain economy discussions is, could Canada take the lead really in saying, here's an example as a microcosm of how it could work in other places? Because if we can make it work here, then that could be the blueprint for how it could work in other places. And especially given Canada's commitment to diversity and inclusion, which is not always seen in other parts of the world right now, I think we're really well positioned to take the lead if we can, reframe that conversation. Dallas, Samir, anything you wanted to add on this?
I maybe just I think we need to think very broadly about this too. So if you like all of us here kind of work in the dementia aging field, right? We also need, the economists and pediatricians and
Yes.
educators and climate scientists, to be thinking about this. And we look at all the risk factors, things like early life education. There's probably a role for us to also be adding our voice to improving education for people, lending our voice to improving climate action, right? All these things have air pollution, all these things have an impact on dementia. And I think that those connections sometimes aren't always made, within the health sector, but let alone like across ministries or levels of government. So, there's very few aspects of society that probably don't have implications for brain health, and there may be opportunities for us to lend our voice, and our expertise for things that maybe are well outside of health or aging, that have big implications for brain health.
Yeah, for sure. And I think it was mentioned before. I mean, the importance of bringing in younger folks, and dementia doesn't start in your 70s or 80s. It starts decades and decades before. We know early education, which is one of the risk factors for dementia, is most critical early in life. And we absolutely have to start thinking about it less as a health issue and more of a societal issue. That's really great. Just one last question for y'all on this topic. If you think about advice that you might give to policymakers, just in this context of everything we've talked about so far, what advice would you have for policymakers about the trade-off between action or inaction today and societal costs later? Keeping in mind, sometimes politicians, no offense, some of my best friends are politicians, but often they're thinking about what do they need to do in the short term to, stay in power, get elected. But with longer term planning, what advice would you have for policymakers? Yeah, Saskia.
Maybe I'll dive in. I think that we do need to think of policymakers and decision makers as human. And so recognizing, as you said, that they are going to have to think about the short term as much as we want them to think long term. And so really aligning the kinds of advice that we're giving them or evidence that we're giving them with what they can practically achieve in the short term over a 1 to 2 year period, and an investment that is short term, but that could pay the longer term dividends. But something that they can benefit from as well, because ultimately decision makers, particularly policymakers, have to respond to their voters. And so if their voter base is saying, dementia, aging, prevention, risk reduction are important to them, and they can see a path to making an investment in the short term that could enable those things. I think that is how we've been trying to message and align pieces for the task force and other work. The longer term policy around the economic impact, the delaying and what that means, I think is more of a federal level approach. And also there's differentiating between what is within federal mandate and what is within provincial mandate. And being able to really say that at the federal level, the public health awareness, risk reduction investments, research investments Economic investments are really at the federal mandate, but some
Right.
of the more specific coordination, dementia, health, municipal investments are at the provincial level, and helping people understand that, and then really mobilizing the voices of people with lived experience constituents in enabling those are what I would say are probably the key messages that we need to be able to provide in very practical ways, not just change all
Yes.
policy and
Yes.
align everything.
Yes. Yeah. Just saying change things without how is not usually very helpful. I want to turn to some of the questions that we've got in the Q&A. And again, reminder for people, if you have additional questions, please put them in the Q&A. If you want to upvote something, do that. The one right now that's at the top in terms of upvotes is not really a question, it's a comment, but I'll just draw it to people's attention. The Alzheimer's Society of Ontario is in the final stages of a pilot for their Take Action for Brain Health series. It's 3 sessions, with each session focusing on 3 to 5 of the risk reduction strategies, while participants draft an individual action plan that they design for themselves to address a risk factor that they flagged needs attention. And there's a lot of interest so far. So that series is going to be available through local Alzheimer's societies in the future. So just making sure people know about that. Josh Armstrong says, while Ottawa Public Health has broken new ground with its precision dementia prevention program and dedicated risk assessment hubs, they remain a stark exception in Ontario. For the majority of our 34 public health units, brain health doesn't even explicitly appear in local chronic disease mandates. Given the overwhelming evidence on modifiable risk factors, what are the primary structural or funding barriers keeping public health leadership from formalizing dementia prevention as a standalone priority, rather than letting it sit implicitly under general cardiovascular health? So we had talked before about, is it better to lump it or not? Josh is asking, how do we raise awareness and get it sort of standalone? Anyone want to tackle that one?
And I can mention that, if we think about how public health is organized, again, it's at a provincial territorial level, as opposed to just kind of the broader federal kind of mandate on public health. But what was interesting when I was developing Ontario senior strategy, I remember meeting with the head of every public health unit, because one of the key things when you look at the mandates, what people are mandated to work on, one of them, for example, is falls prevention. But then you found that only a handful of public health units were actually actively engaged around that mandate. And even though it was a mandate, the question was, how much resource are you being given? And then what of your mandate can you actually meaningfully implement? And it really kind of struck me how our public health units, for example, are not funded on a population basis. So if there's a fast growing region of Ontario, you might have historical funding that doesn't even keep up with your population. So you start realizing how we need to really, first of all, invest more in public health and prevention, period. And then number 2 is, have those mandates that, with that appropriate level of funding and support, can allow us to then kind of implement some of these measures. And local communities often know, especially our public health units, where people are at, what messaging works, and how to engage people in innovative programming. So I think, again, it talks about some of these fundamental things that are not allowing us to enable these things as well as they could. But it's great that we have some pockets of excellence like Ottawa Public Health, where we can say, what are they doing, and how can we, replicate, best practices as well.
Yeah, excellent. Anyone else want to chime in on that one? Okay. Next question is, why are women disproportionately affected by dementia scientifically? So we talked a little bit about different groups having different risk factors. We didn't mention is that for Alzheimer's disease in particular, women are much more likely to be affected by Alzheimer's, diagnosed with Alzheimer's, than men. And it's not just because they're living longer. What is the reason that that women are more likely to be affected by Alzheimer's? And maybe someone can also speak to whether that's the case for all different kinds of dementia, because Alzheimer's is just one form of dementia. So, Nicole?
Yeah, the short answer is we don't know. But you're right that it's not just that we tend to live longer than men. There's been a lot of focus on the role of menopause and losing estrogen, because estrogen is neuroprotective. It's good for the brain. But that can't be the whole story either, because every woman goes through menopause, yet not every woman develops Alzheimer's disease. I think we haven't looked enough into the gendered aspects of sex differences, and the roles that women play as workers and caregivers and
Right.
house management. We don't, that might have some kind of influence, but we really just don't know yet. When I give public talks, I mention that age is a risk factor, genetics is a risk factor, sex is a risk factor. But then I say, you know what? I, in my personal life, I prefer not to think about those things because I can't do anything about them. And I prefer to think about all the other things that I can do something about. Um, you're right that sex differences flip in some other kinds of dementias. So, dementia due to Parkinson's is more prevalent in men, for example. So, we can't lose sight of that.
Yeah. Okay, great. Thanks. In terms of exercises and the role of exercise in dementia prevention or support for people living with dementia, the question is, does anyone recommend any specific exercise that people with dementia should do? And can we provide some links to online exercise resources? I know, Nicole, maybe you can mention the project that we have with the National Ballet School. If other people want to mention other things, chime on.
Yeah, the National Ballet has dance programs for people living with dementia, also people living with Parkinson's disease too. They do a terrific job with that. I think it depends on the individual. And talking about falls risk, what is their risk of falls, of what kinds of activities somebody could do? My whole philosophy about exercise is that it doesn't matter how you get there, how you get your 150 minutes a week, as long as you're doing it safely. So that could be walking, that could be swimming, that could be chair exercises, whatever works for the person. It all has the same benefits in the end.
Yeah. And in terms of dementia prevention, Dels, maybe you can mention that as well.
Yeah, I was going to say there. I think there's also like I'm a big fan of outdoor spaces. You want to talk about public policy and access. I think there's also some so absolutely having exercise that's like safe and meaningful that people want to engage in. There's probably also some additional benefits for being outdoors or having some um, uh, exercise or activities. It doesn't have to be exercise. Activities that are outdoors that have some additional benefits, which can come with its own challenges with climate and things like that. So I do as much as possible try to encourage people if they if it's safe for them to be outside and often with someone else, that's probably some of the best exercises to actually be in a natural environment, which has in addition to the benefits of the exercise, even just passively being outside in nature has a cognitive restoring benefit for above and beyond just the physical exercise. And they've shown, if you get people to walk in an urban environment versus a park, or even just looking at outdoor pictures can have some of that benefit as well. And I think, some of the evidence on dementia prevention and air pollution and things like that is these are environmental studies, right? You're not piping exhaust into people's homes. You're looking at people who are in more urban versus rural communities. And some of that is also access to green space and making sure that our outdoor spaces are accessible for people with mobility and cognitive changes. And a great example of that is Calgary, where I worked before, has actually developed a dementia-friendly park.
Right.
That's designed, to try and get people outdoors and engaging, which is, kind of taking age-friendly communities like another sort of step further to think about dementia-friendly or cognitively friendly communities and public spaces.
Yeah. Saskia?
Yeah, I was going to add, age-friendly and dementia-friendly communities. Calgary and Vernon, I think, is another that have really adopted that approach and then started to open up more green spaces and community-based approaches. But I was also thinking about shared exercise programs. So sometimes, particularly even after a diagnosis of dementia, both the person living with dementia and their caregiver or care partner can have shared exercise opportunities, and so it's an opportunity to get out of the house, but also to be able to build more social connection. um, I know that I believe the Alzheimer's societies do offer a program called Minds in Motion, which is that kind of shared exercise approach, and it emphasizes both the physical activity but also the social connectedness of things. And I think that's the thing around exercise programs is what we're trying to say with risk reduction is it's holistic, right? The exercise is important, the physical activity,
Right.
but then as Dallas said, the environmental, being out in green spaces, the social connection,
Social.
the all of it is it's interconnected, as well as what you're eating and how you're eating, and again having that in a more social environment is good. So I just want to raise that we want to think about it connected to all of the factors and not just on its own.
Yeah, and also there's the intergenerational impact. Like, so
Exactly. Yeah.
back to that. I know in Ontario, there's I apologize, I'm blanking on the group's name, but there was a group of high school university students, I believe, who created a table tennis program where it's the students playing with older adults in certain communities. That's gotten a lot of attention. And they're doing it really because they were inspired by their grandparents who were, struggling with their brain health, and it was something that they enjoyed. So that intergenerational element in the group programming is great too. There's a question saying that someone would appreciate it if the panel could talk about the role of a proactive screening tools and how they might contribute to awareness efforts. So we talked a little bit about these sorts of tools, like things you can screen in advance. I'll just very quickly mention, we can put links in the chat perhaps. Baycrest has a free online hearing screening tool for people who want to just sort of check and see where's their hearing. But we also have a brain health assessment screening tool called Cognicity that is again free. So other kinds of screening tools, proactive screening tools, how do they contribute to these awareness efforts?
I'll just mention that Cognicity also has a smart tracker as well that asks people about different domains and where they're at and kind of highlights what areas they should focus on.
Yeah. And just in general, what do people think about these kinds of screening tools? It also could be like if you're wearing your Apple Watch and you're measuring your sleep and things like that. Like what do people think about? Does that contribute to awareness?
I think absolutely it does contribute to awareness, and actually, I mean, it can also help health providers kind of think about things as well that sometimes we miss. I think the key thing, like a smartwatch, is kind of also like tied to like a behavior things. If your steps are, if you've only got 2,000 steps, you know what you can do about that, right? You could be moving a bit more. So I think one of the key things is to like the assessment and the awareness building is important, but also needs to be tied to like supports or strategies you could use, to sort of address things. And I think, kind of taking it that next level, the screening on its own, ideally if it's coupled with, information or strategies or supports to then be able to like act on that or communicate that to someone who can help you with that is an important part, the raising awareness, but also empowering and empowering people and sort of giving that self-management or self-efficacy as well.
Okay. I just also want to remind people we're going to be launching a poll in the chat. So please make sure that you take a moment to answer that poll. And this is really just, what your takeaways are from today's session. We'll keep answering a few more questions before we wrap up. One is the incidence of dementia striking younger seniors because the economy needs these younger seniors to continue working and paying taxes? So what's happening in the young old versus the older old?
I mean, I wouldn't say that, I don't think we'd say that there's, that you say younger people are necessarily being struck more, compared to older people, if I'm interpreting the question, in that way. But I think the key is that, what we are becoming aware is that, I think for younger people, sometimes it's harder to get a timely diagnosis, right? People are not thinking about dementia as something that happens kind of in younger people, and I'm talking about people who are younger, say, than 60 or 50, for example. So I think, the good news is that the incidence of dementia is actually decreasing in terms of, because we have been doing more brain health kind of related things, like better managing our heart health and stroke health, from that perspective. But we still have, just with the sheer number of people who are aging in our society, we're going to be having more people living with dementia. And so making sure that we can get people aware that dementia exists, that we can get people talking about it earlier, seeking help earlier, so that they can get a timely diagnosis and management, I think will be absolutely, is still a huge priority, given that, there are estimates that 2/3 of people in Canada who are living with dementia are still undiagnosed. So I think it really tells us about what we need to be doing. But anyways, I hope that just kind of gives a little bit more context, maybe, to help think about that question.
All right, great. And we'll run through a couple more of these really quickly. The Canadian healthcare system is very antiquated in terms of the knowledge it provides. How does one participate in changing it? This is really a question about how can people out there help in taking action?
I'll chime in on that. I think there are a couple of different ways. One, and this has been sometimes people don't realize really the power of participating in research. And there's also forms of research that people can participate in. Everything from obviously most people think clinical trials, but there's a range of research that looks at everything from brain health, risk reduction, to screening, to treatment options, quality of life. And a lot of different organizations support that. And they almost always are looking for people who are interested in their brain health, or living with dementia, or caregivers who want to participate. And then there are organizations like CABI, and I know others like the Alzheimer's Society, Parkinson's Society, et cetera, that often have advisory committees and advisory groups that are looking for people living with dementia. Again, caregivers, people interested in dementia or brain health, who can help shape some of that discourse. And then there's direct advocacy. I think if you're really wanting to shape how politicians and decision makers are thinking about things, there's public approaches to sharing your stories, whether it's through op-eds and engaging with media, but it's also through letters to MPs and participating in broader campaigns around it. So there's, I think, a range of different things, but often it's finding the organizations that help create the platforms to support those. Though we have met some very, very strong and powerful advocates who are individuals on their own, who have worked with their local MPs to really to shape and move the direction of some of these conversations.
All right, great. One last question here. The United States recently made it possible for medical quality hearing aids to be sold like other consumer technologies. And that's led to some, according to this person, some major companies to produce hearing aid devices that might lower prices, but could also be subpar due to deregulation. What is the balance around trusting dementia prevention priorities, like correcting hearing loss, to market competition versus asking government or public systems to be in charge of it? So I see people nodding and thinking. Who wants to take this one on? No one. Okay. I will just say, Samir, yeah, go ahead.
Well, no. Go ahead, Alison.
No, you went off mute. You're going.
No, fair enough. No, I was just saying. No, I mean, it's a good point, right? I mean, again, we want to make sure that we enable technology and devices that can support positive moves in brain health and other aspects of health and wellness. But we also have to remember that we have to have a certain level of regulation and quality, and the right engagement of appropriate professionals. Otherwise, there is a chance that people might be investing in devices that might not ideally be suited to help them, keep their brains healthy, or manage other health opportunities well. So I think there is a fine balance, and I think before we make any significant decisions in Ontario or the rest of Canada, we need to make sure that we're thinking about these well.
Yeah, and CABI, one of our raisons d'etre is to support innovators in this space. The Center for Aging Brain Health Innovation. We support all the way from design and development through validation and refinement through spread and scale and adoption. And one of the things that's required is when people are doing their testing that they're also sharing the results of their testing. So I would say there's a lot of bad information out there. There's a lot of, even outside of technology, take this supplemental because it's made from jellyfish, so of course it's going to work. Like that doesn't really make any sense. If it doesn't make sense on the surface, maybe it doesn't make sense down below. But you can also do your research and see what is the science behind each of these. What's the evidence that it works? Dallas.
Yeah, well, hopefully this isn't taking things in too far off a direction, but also I think in terms of like technology and these things, it's important that we have options for people, because technology is not a fit for every person. And I'd also just say that while we need to be thinking about dementia prevention, let us not forget we're half of dementias won't be preventable.
Yes.
I think even that is probably optimistic now. And so while it's good that we have attention on that, we also have to be thinking about, at least in the short term as well, how do we improve and advocate for more care for people, which does mean people, right?
Right.
And I think technology will help some of that, but we need more people and more resources to support people who have dementia, and people who are going to continue to develop dementia despite our best prevention efforts. So hopefully that's not meant as a downer. There's a lot we can do on the prevention front, but there's also a lot of good care that people could be receiving right now that they aren't, that they should be. And so I think we need to kind of keep, it's an and, right? We need more focus and research on dementia prevention. We also need to support people who have dementia better. And both of those take some attention and resources, and they're not in competition with each other, but they need to be moving forward kind of hand in hand.
Absolutely. I'm going to take that, Dallas, as your final word. And I'm going to turn now to each of the other panelists and ask them for their final word. So, Samir?
I think no, this has been a terrific chat, and a real reminder that there are so many things that we can do to enable people to stay healthy and well, and to really improve their brain health. So, as we said, this needs to be a societal approach that also enables an individual approach to this. So we've got a lot of work to do, but I think there are a number of committed people here on the chat who are and this webinar who are willing to do so. Thank you.
All right, Saskia?
I'm biased on this, of course, but I think that part of the conversation that really helped enable my thinking is that this balance between the individual and the system, and how they have to work in a loop to support each other, and that this is a pathway, right? This is a broader pathway, because you can do a lot to reduce your risk and still possibly develop dementia, right? We don't want people to walk away thinking that it's preventable entirely. And I think this is why that care coordination and re-enablement and all of the rest of that pathways is just as important.
Yeah. Last word to Nicole.
Yeah, I think just circling back to the idea that we need to approach it from all angles. So that improving the healthcare, improving the community resources, improving the federal investment. That's the only way that we'll get this done.
Yeah, thanks. And I want to say thank you to all of you, the panelists, for bringing this conversation into the awareness of the Canadian public. Thank you to the CSPC and CABI for organizing the panel. Thank you to the entire audience for everything you've done in being here with us, helping, going out there and spreading that word, your wonderful questions. And if you haven't already answered the CSPC feedback poll, please do that. And otherwise, you'll see a whole bunch of different links in the chat. You can learn more about the Age Tech Insights reports, the Defy Dementia, all of CSPC's policy events. Panelists, if you want to put any plugs in there, go ahead if you haven't already done so. And just thank you to everyone, and have a wonderful day, and a happy Canada Day to everybody as well.